Varicose veins are dilated, tortuous veins. They're often seen in the skin and then the result of venous disease in the legs. Spider veins are any veins that are less than 3 millimeters in size that you can see on your skin. They're often blue or red. And the technical term for the blue ones are reticular veins. For the little tiny red ones, it's telangiectasias. They result from the same venous disease that often cause varicose veins. You should consider treatment of your varicose veins if you have any of the symptoms in your legs, such as pain, aching, throbbing, cramping, restlessness, swelling. If you've had phlebitis in the past, if you've had bleeding from any of your varicose veins or spider veins, you should definitely consider treatment, because your disease will only worsen over time and become more difficult to treat. We've made a great deal of progress in the last 15 years with the treatment of venous disease and varicose vein disease. As a surgeon, the only thing we had 15 years ago was the old stripping procedure. Most patients did not like the stripping procedure because they'd have to have their procedure done in a hospital. They'd often require people to drive them there and back, and often your leg would be wrapped and you'd be laid up on the couch for 2 weeks after that. None of us have that time to give anymore. And back in 2002, the FDA approved laser ablation of varicose vein disease and the great saphenous vein in your leg that's often the cause of varicose veins. And since that time, endovenous ablation with either laser or radiofrequency have become the gold standard, primarily because the treatments can be done in the office. They do not require any sort of downtime. You could go back to work the same day that you've had your treatment. The other big problem with stripping, besides the pain, was the higher rate of recurrence. Stripping used to induce something called neovascularization, which is a creation of new veins. And unfortunately, these new veins which were created did not work very well. So patients would come back to see me 2 years after their stripping, and their problem would be back and it would be worse. All procedures for venous disease are done in our office. We do not sedate patients, so you're safe to drive yourself here and drive yourself home. The initial procedure, which is a procedure used to treat the main source vein, will take me about 30 minutes to perform. It involves a series of injections with numbing medicine. I don't want to say that this treatment is pain-free. It's not. It does involve needles and numbing medicine, but it's not so painful that we have to knock you out to do it. So you will be safe to drive yourself home. You'll be safe to continue on whatever normal activity you would be doing that day. All the procedures that we do here to treat venous disease are done in the office, and they're procedures that do not require any time off of work. My personal feeling is that we work our entire lives. When you have a procedure done, take a day off, but you don't need to. So you can, in fact, you don't need to have anyone drive you here to the office to have your treatment done. In fact, you can have your treatment done at noon and drive back to work after lunch if you wanted to do that. A perfect storm of things came together to revolutionize treatment of veins disease. And one of those was the ability to do high-resolution ultrasound in the office. That allowed us to search out for the source vein and identify it. In the past, when as a surgeon I was doing the old stripping procedure, we would send you to the ultrasound tech just to be sure you didn't have a blood clot in your deep veins. We never did check the superficial veins to see which ones were working and which ones weren't. We would just automatically strip out the great saphenous vein. And it turns out the great saphenous vein was only the cause of problems about 70% of the time. So we were missing the disease 30% of the time. Well, with the advent of high-resolution portable ultrasound, we were able to do ultrasounds in our office and become much more sophisticated in our treatment and target the exact veins which needed to be treated. Over the course of the last 10 years, ultrasounds have only become smaller and much improved in terms of their resolution, their ability to see veins which are refluxing. At Southern Illinois Vein Center, we have the most up-to-date, highest resolution portable ultrasounds in the industry. A high resolution ultrasound is important because in order to identify vein disease, we have to look at the flow inside the vein, and we have to determine if flow is going back towards your feet in a vein. And sometimes it's not that easy with the lesser quality ultrasound. So a high quality ultrasound with high resolution is very important to detecting all vein disease. The three revolutions that came together to bring about treatment of vein disease in the office were, one, the ability to identify the source vein with high-resolution portable ultrasound. The other was the ability to treat the source vein with heat, either generated by a laser or by a radiofrequency device. Here we have the most up-to-date radiofrequency device put out by Covidien,